Welcome to the only place that turns stacks of essential medical sources into streamlined, high-yield knowledge. We know you're juggling a heavy clinic load, trying to prep for boards, and it can be a lot.
It is a lot, and that's why we're here today. We're going to give you the ultimate cheat sheet on one of the most foundational topics, pediatric developmental milestones.
Exactly. Our mission today is to build a mental framework for you, so when you walk into that exam, you can tackle any development question with, I'd say, 99% certainty.
That's the goal. This isn't about rote memorization. It's about understanding the predictable patterns, the architecture development, so you can spot the abnormal instantly.
Okay, let's unpack this. We're starting with the absolute blueprint, the architectural structure.
You have to have a structure. And for every single well-child check, and for every board question, you must assess a child across 4 streams of development. We call these the 4 pillars.
And for those pillars, we use that classic mnemonic GFLS.
GFLS. That's G for gross motor.
So the big movements, sitting, walking, balancing.
Exactly. S is for fine motor. That's your small muscle control.
Grasping, drawing, manipulating little objects.
L is for language, which includes both receptive, what you understand, and expressive, so what you can say back.
And finally, S for social cognitive.
Right, how a child interacts, how they play, problem solve, and eventually self-care.
And it's so important to remember how these 4 streams interact, right? A delay in one can absolutely cascade into the others.
Precisely. A gross motor delay means less exploration, which then impacts cognitive and fine motor chances. The pattern of delay, whether it's focal in just one stream or global across all 4, is your first big diagnostic clue.
Okay, so before we dive into specific ages, we have to lay down the golden rules of development.
These are the principles. If you know these rules, you can often predict the sequence, even if you forget the exact month.
So rule number 1 is all about flow.
The physical flow. Development is always cephalocaudal.
Head to toe.
Head to toe.
Yeah.
Head control comes first, then trunk control for sitting, then finally leg control for walking. And at the same time, it's Proximal-Distal.
Center to periphery.
Exactly. Core stability before you get that fine, delicate finger control.
So if you see a kid with a perfect pincer grasp, but they're still floppy in their core, that sequence is wrong.
That violates the rules.
Yeah.
And that violation often points directly to a central nervous system issue, like cerebral palsy, where that whole orderly progression is disrupted.
And that same kind of flow happens in communication, too.
Yes. Receptive language always precedes expressive language, usually by about 2 months. A child understands far more than they can say.
Which is so crucial when you're assessing a nonverbal child.
It is. You have to rigorously test what they understand. Silence doesn't mean they don't know what's going on.
What about the very first social marker we can pin down?
The absolute earliest anchor is the social smile. You should reliably see it between 6 and 8 weeks. It's not just a gas bubble. It's a real responsive connection.
And its absence is a huge deal.
One of the earliest and most alarming red flags.
Okay, let's circle back to primitive reflexes. The key here isn't that they appear, but that they
disappear. The persistence of a primitive reflex is the pathology. These are brainstem movements. For the cortex to take over with voluntary, purposeful movement, it has to suppress these lower systems.
So a persistent reflex means the cortex isn't doing its job.
Exactly. It suggests a failure of maturation or an injury. If the boards ask about a persistent reflex, the answer is almost always CNS pathology.
And one last crucial detail for our listeners, corrected age for preemies.
Right. For any baby born before 37 weeks, you have to adjust their age. You subtract the weeks of prematurity from their chronological age.
And you do this for all milestones, but only for a limited time?
Correct. You only use corrected age until the child turns 2. After that, the expectation is that they've had time to catch up.
Perfect. So that's the science. But let's get to the most important point for the exam. We're not interested in the average age of baby walks.
No, absolutely not. The boards in clinical practice demand that you know the outer limits of normal. When do you have to worry? At what age must a skill be present, or else you have to suspect pathology? That is the key.
All right, let's start with the hard data, the physical growth metrics. These are often the first part of a clinical scenario on an exam.
And they should be. They're fundamental. Failure here can point to nutritional or metabolic issues before you even get to neurodevelopment.
Let's start with weight. There are 4 key targets.
The very first checkpoint. A healthy baby should be back to their birth weight by 2 weeks of life.
That confirms feeding is going well.
Exactly. After that, growth is just explosive. Weight doubles by 4 to 5 months.
Wow, doubles in 4 months.
It's an incredible rate.
Right.
Then it triples by 1 year and finally quadruples by 2 years. If a child's falling off that curve, you're launching a big workup.
Okay, what about height or length?
The increase is staggering in that first year. Length increases by 50% by the time they're 1.
50%, so they're 1.5 times their birth length.
Right. And then that growth slows down, but their length doubles by age 4.
And the third physical pillar, head circumference. This is brain growth in real time.
It is. The average at birth is about 35 centimeters. But in those first 3 months, it grows about 2 centimeters per month.
2 centimeters a month, that's massive.
It reflects that huge synaptic growth and myelination. Microcephaly, or macrocephaly, are major red flags for central nervous system problems.
And it's really the rate of change crossing percentiles on the chart. That's the key diagnostic flag.
That's the key.
Okay, now let's move to those primitive reflexes. We said their persistence is the problem. Let's go through the must-know list.
This is highly testable stuff because it connects neurology right to your physical exam.
Let's start with the king, the Moro reflex.
The Moro. Present at birth, gone by 3 to 6 months. You do that gentle, sudden head drop.
Safely, of course.
Of course. And the baby's arm should symmetrically abduct and then adduct, like an embrace.
But the clinical gold here is when it's asymmetric.
Yes. An asymmetric Moro is a massive focal red flag. You're immediately thinking about a brachial plexus injury, like an Erb's palsy from birth, or a clavicle fracture.
Or it could be something central, like hemiparesis.
It could. The boards love that differential.
Okay, what about the feeding and grasping reflexes?
Rooting is simple stroke the cheek. The head turns toward the stimulus. Gone by 3 to 4 months. Then the palmar grasp.
Put a finger in their palm, they grip it tight.
And that's gone by 4 to 6 months. If it persists, it physically blocks them from voluntarily releasing objects, which messes up their fine motor development.
And the one that looks so striking, the ATNR, or the fencing posture?
Right, the asymmetric tonic neck reflex. You turn the baby's head to one side, and the arm on that same side extends out, while the opposite arm flexes.
The classic fencer look.
Exactly. And it has to be gone by 4 to 6 months. If it sticks around, the baby can't bring their hands to the midline. They can't reach. They can't roll properly. It's a huge problem.
So if you saw a persistent ATNR at, say, 7 months, what couldn't that baby do?
They absolutely could not roll over, and any two-handed activity would be impossible. The reflex just locks them into that asymmetric posture.
Okay, what about the ones that disappear really early?
The Guillant stroke along the spine, the trunk curves toward that side, gone by 2 to 3 months, and the stepping reflex, which is gone by 2 months, less critical, but they confirm early brainstem function.
Now, for the ones that stick around a bit longer, the late disappears.
The plantar grasp. You press on the sole of the foot and the toes curl. That one hangs on until 9 to 12 months.
And has to go away for them to stand and walk properly.
Right. You can't stand flat if your toes are constantly gripping. And then there's the Babinski.
Which is normal in an infant.
Normal. Stroking the lateral sole of the foot makes the big toe go up and the other toes fan out. This is normal up to 12 to 24 months.
That's a wide window.
It is. Don't call pathology on a positive Babinski in a 15-month-old. But after 2 years, it is definitively a sign of an upper motor neuron lesion.
So we have all these reflexes disappearing, but there's one that appears later and stays forever.
The crucial exception, the parachute reflex. It shows up around 8 to 9 months.
And this is a protective one.
Yes. You hold the child prone, tilt them forward, and their arms should shoot out to break the fall. If a baby who is starting to sit and crawl doesn't have this, they can't protect their head. It's a major safety issue.
So a quick summary for this section. Think most gone by 6.
Moro, rooting, palmar, ATNR, all gone by 6 months. The exceptions to remember are plantar, Babinski, and the one that persists, parachute.
Okay, let's move into the core infancy progression from 2 to 12 months. We're tracking GFLS year by year.
And you can really see that cephalocaudal head-to-toe progression in action here.
We'll start at the 2-month visit. This is really the first major checkpoint.
It is. And the theme here is the beginning of control. For gross motor, they're starting to conquer gravity. They can lift their head 45 degrees when they're on their tummy.
And there's less head lag when you pull them to sit.
Much less. For fine motor, their hands are starting to unfist. They can hold a rattle for a second, and this is a big one. They track objects past the midline.
Why is tracking past the midline so important neurologically?
It means the two hemispheres of the brain are starting to talk to each other. It requires cortical coordination. Failure to do that could mean a vision or a central processing problem.
Language at this point is pretty simple.
It's cooing, just pure vowel sounds. Ooh, oh.
And the social star of the show.
The responsive social smile. It's the anchor of the 2-month visit. It shows they're processing social cues. It's the start of that parent-infant bond.
And the red flag here isn't absolute.
No social smile by 2 to 3 months is a major problem. You have to think about vision, global delay, or even very early signs of something like ASD.
All right, on to 4 months. Head control is solid now, and they're starting to use their core.
Gross motor is huge here. They lift their head a full 90 degrees when prone, propped up on their forearms, and critically, there's no head lag when you pull them to sit.
Head control is complete.
Complete, and they start rolling, but specifically front to back.
And the boards love asking about that sequence, right? Why front to back first?
It's physics. Gravity helps them. Rolling back to front takes more deliberate core strength, which they'll get by 6 months.
Got it. Fine motor at 4 months.
They're reaching for objects deliberately, and they bring their hands together at the midline. That's a fundamental skill.
And for language?
They're laughing and squealing. They're really orienting to voices now.
Okay, 6 months. This is a massive milestone. Sitting begins.
A huge leap. Gross motor. They sit with support, usually in that tripod position with hands on the floor in front of them. They roll both ways now, and they bear weight on their legs.
And fine motor is moving from just reaching to actually manipulating things.
Yes, you see the raking grasp? They use their whole hand like a rake to scoop up objects.
Yeah.
And they transfer objects from one hand to the other.
Which shows great bilateral coordination.
And everything goes in the mouth. For language, we move from vowels to babbling. The consonant-vowel combos. Ba-ba, da-da. Socially, stranger anxiety starts to kick in.
And the red flag for this age is a big one.
It is. No babbling by 6 months requires an urgent hearing evaluation. If they're not making those sounds, you have to assume they're not hearing them.
9 months. We're getting close to walking, and there's a huge cognitive shift.
Huge. Gross motor. They go from sitting with support to sitting unsupported very reliably. They're crawling, pulling to a stand, and cruising along the furniture.
Fine motor is all about that developing pincer grasp.
The immature pincer grasp, using the pads of their thumb and index finger. And they love banging 2 objects together.
Language starts to sound like real words, but it's not specific yet.
Right. They'll say mama or dada, but it's not specific. They do understand no, though, and they can wave goodbye.
But the key cognitive pearl here is object permanence.
Yes. The understanding that things exist even when you can't see them. This is why peekaboo suddenly becomes the best game ever.
And why separation anxiety gets so intense.
Exactly. They know you still exist when you leave the room.
And that brings us to the 1-year-old. The 12-month check. We're looking for independence.
Independent mobility and meaningful communication. Gross motor. They're walking with one hand held, maybe taking a few independent steps.
Fine motor gets really refined here.
You see the mature pincer grasp? Just the tip of thumb and the tip of the index finger. Perfect for picking up a single Cheerio.
And they're pointing.
That purposeful finger point is critical for joint attention. For language, they finally connect sound to meaning.
So 1 to 3 words with meaning. Mama is now for mom.
Specifically for mom. And they can follow a one-step command, but with a gesture.
So you have to point while you say, give me the ball.
You do. They still need that visual cue.
And the red flag to close out infancy.
No single words by 12 months. Or, even more concerning, any loss of previously acquired words at any age. Regression is always a problem.
Now we're accelerating into toddlerhood. This is where we see that vocabulary explosion.
It is an explosion. And this period is defined by quantifiable things. The boards, love block towers, word counts.
Okay, 15 months. What are we seeing?
Gross motor. They are walking independently. They can stoop to pick up a toy and stand back up without falling.
Good balance.
Excellent balance. Fine motor.
Yeah.
They can build a tower of 2 cubes and scribble. Language is about 4 to 6 words.
On to 18 months. This is a huge age because it's the first time we do universal screening for autism.
It's a major hinge point. Gross motor.
Mm.
They're running, although it's a bit stiff. They can throw a ball overhand.
Fine motor. How many blocks in the tower now?
The tower jumps to 3 to 4 cubes. Language is where you see the big leap, though.
Into the double digits.
Vocabulary jumps to 10 to 25 words. And crucially, they can now follow a one-step command without a gesture.
That's a real test of their receptive language.
It is. Socially, pretend play starts. They're feeding a doll, making car noises.
And the red flags here are firm.
No words at all, or not walking independently by 18 months, requires an immediate, full developmental evaluation. No waiting.
Okay, the 24-month or 2-year milestone. I love this one, the power of 2.
Everything seems to come in twos. Gross motor. They run well, and when they do stairs, they use 2 feet per step.
They bring one foot up to meet the other before taking the next step.
Exactly. Fine motor.
Yeah.
The block tower hits 6 cubes, and they can copy a vertical line.
Their first real drawing task.
Right. And language is the main event at 2 years. You need 50 or more words, and you need 2-word phrases.
So, more juice or mama up?
Yes. Both the 50 words and the 2-word phrases are the cutoff. And their speech should be 50% intelligible to a stranger.
Let's lock in that intelligibility rule. It's so useful.
It's a great one for the boards. 50% intelligible at 2 years, 75% at 3 years, and 100% at 4 years.
2, 3, 4 equals 50, 75, 100.
Exactly. And socially at 2, they're doing parallel play.
Playing alongside another kid, but not with them.
Right. And they can follow 2-step commands. The power of 2.
Now we're in the preschool years. The focus shifts from just basic movement to complex coordination.
And you see this mastery of drawing geometric shapes, which is a great window into their visual motor integration.
Let's start at 3 years old, the tricycle age.
That's the one. Gross motor. And they can pedal a tricycle. They can go upstairs alternating feet, so 1 foot per step.
But not down yet.
Not down yet. Fine motor. They copy a circle. Their person drawing has 3 parts. The classic tadpole person.
Language at 3.
3-word sentences. Vocabulary is over 250 words, and they are 75% intelligible.
And socially, they move past parallel play.
Into group play. They're playing near each other, maybe sharing, but there isn't a common goal yet.
The red flag here is tied to that sentence length.
No 3-word sentences by age 3 is a definite referral.
4 years old, the hops and stories age.
Love that. Gross motor. They can hop on 1 foot. That's a huge leap in balance.
Yeah.
And they master the stairs, going down alternating feet now.
Fine motor, what's the next shape after the circle?
They copy a square and a cross. 4 corners requires more planning.
Language becomes a narrative.
Yes, they tell complex stories. Their speech is now 100% intelligible. And this is the Y phase.
Oh, it's a Y phase.
Constantly. Socially, they shift into true cooperative play.
So now they're working together on a shared goal, like building a fort.
Exactly.
5 years old, they're getting ready for school.
These are the kindergarten-ready skills.
Yeah.
Gross motor, they can skip. Fine motor, they copy a triangle.
And they can often tie their shoelaces.
A huge functional skill. Language. They're using future tense, counting to 10, defining simple words. Socially, they have a best friend, and they understand the rules of games.
And finally, 6 years old. This is the mastery stage.
Riding a bicycle without training wheels.
Yeah.
Fine motor, they conquer the last, most complex shape.
The diamond.
The diamond. They write their name. Socially, they're competitive and have a real sense of fairness.
Okay, let's quickly review those 2 big progressions that span the preschool years. First, the shape progression.
It's so predictable and testable. A vertical line at 2,
Then circle at 3.
cross or square at 4,
Triangle at 5.
and diamond at 6. The complexity just increases with age.
And the social play progression.
From solitary play as an infant
Yeah.
to parallel at 2, group play at 3, and finally cooperative play at 4. It's a beautiful map of their social maturation.
Okay, this last section is where we distill it all down. These are the high-yield, when-to-worry triggers that you absolutely have to know.
This is moving from description to diagnosis. And we have to start with the single most critical concept in all of pediatric development.
Which is regression.
Regression. Losing a previously acquired skill is never, ever normal. It means an intact system has been damaged or destroyed.
So regression is always pathological.
Always. It demands an immediate, extensive workup. You have to think about neurodegenerative diseases, inborn errors of metabolism, specific syndromes like Rett,
And autism spectrum disorder.
and ASD, where we often see that loss of language or social skills between 18 and 24 months. You never wait and see with regression.
Okay, let's talk about using those GFLS pillars to differentiate between focal and global delays.
If you have a focal delay, say just in language, but everything else is on track, you look for an isolated issue.
Like hearing loss.
That's the most common one. But if all 4 streams are delayed, that's a global developmental delay.
Which suggests a more widespread problem.
Right, a genetic syndrome, intellectual disability, the workup is much more expensive.
What about another focal finding? Asymmetry.
We talked about the asymmetric Moro, but a huge pearl for toddlers is hand preference before 18 months.
So if a 10-month-old is always reaching with their right hand,
That's a red flag. It suggests the other side is weak. You have to be thinking about something like hemiparesis or cerebral palsy.
let's talk about autism spectrum disorder. Boards love this topic. We screen at 18 and 24 months. What are the early warning signs?
The chat mnemonic is a great way to remember them. C is for communication concerns.
Specifically, no babbling by 12 months, no single words by 16 months.
And no two-word spontaneous phrases by 24 months. That's a hard stop.
H is for hearing their name.
Or rather, not responding to their name by 12 months.
A is for attention, joint attention.
The ability to share focus. A classic sign is not pointing or not following your point by about 14 months.
And T is for together play.
Right. A lack of interest in other kids, or not imitating simple actions like clapping.
And for the formal diagnosis, you need both social communication deficits and
restricted repetitive behaviors, RRBs. Things like hand flapping, lining up toys, intense narrow interests. You need both categories.
And the bottom line for a failed screen.
Do not wait. Do not reassure. You refer immediately for a comprehensive evaluation. Early intervention is everything.
So let's provide the ultimate summary. The top 6 red flags, the outer limits you cannot miss.
Commit these 6 to memory. 1. No social smile by 2 to 3 months.
2. No babbling by 6 months.
Which means an immediate hearing evaluation. 3. Not sitting unsupported by 9 months.
4. No single words by 12 months.
5. Not walking independently by 18 months.
And 6. No two-word phrases by 24 months.
If you see any of those on an exam or in your clinic, the answer is always aggressive evaluation and referral.
So that's it. A complete top-to-bottom blueprint of development. We've covered the GFLS framework, the cephalocaudal flow, the block rule, the intelligibility rule. Knowing these patterns is your greatest power.
It is. So our final advice to you is this. Know the outer limits. Never, ever rationalize regression. And always use corrected age for preemies until they're 2. When you're in doubt, just refer. Early intervention is a medical imperative that changes lives.
So as you move forward, here is one last thought to connect these milestones to the bigger picture of brain science. Why is the timing of that universal screening at 18 and 24 months so perfectly aligned with the window where we often see language regression in disorders like ASD? What are the mechanisms beyond just getting a diagnosis that make that specific window so profoundly important for long-term outcomes? Think about brain plasticity, sensitive periods for language, synaptic pruning. Those are the real reasons behind the urgency of every single milestone we covered today.
Master these patterns. Good luck with your preparation.